Hi, everyone. This is Melissa Cleater with the National Fund CareerSTAT Program Manager. Thank you so much for taking the time to join us today, particularly given this three-pronged public health, economic, and racial justice crisis that we've been facing over the last 5 months. Taking a step back during these unprecedented times, is I'm sure a phrase that you are very familiar with at this point, is understandable and sometimes very necessary positions for organizations and individuals to take in this moment. However, many CareerSTAT members have really leaned into this moment. They are eager to learn from peers about how they are handling these crises, and they want to share the lessons they've learned thus far with their colleagues across the nation. So to meet this need for requests and folks wanting to connect with peer learning, we're hosting a webinar series with one webinar each month for the rest of the year. This series features healthcare leaders sharing practices and strategies to address COVID-19 response and recovery, as well as the opportunity to redesign jobs to improve the quality of those jobs and really prioritize racial equity and inclusion within their organizations. So we are kicking the series off today with the very ever-present topic around making the case for workforce development. Next slide, please. So before we get too deep, I do want to take a moment to do some quick housekeeping. If you are using a phone and a computer, please make sure your computer audio is off to prevent some nasty feedback, and the instructions on how to do that are on the screen. In terms of the agenda for today's call, we're going to start with a few polls just to get a sense of where folks on the line are at on a few issues. And then we're going to have 2 short presentations followed by Q&A. Now, if you have questions throughout the presentations, I do encourage you to use the chat function to enter those. We may not get to them immediately, but I don't want you to lose the good thoughts or questions that you have in the moment. So please use that chat function. And then speaking of the chat function, I would love for folks to use it right now just to give us a quick hello and where you're calling from, so we can all get a sense of who's on the line with us. So I really appreciate that. All right, great. I see a few people coming through. We got New Orleans, we got Massachusetts, Maryland, Ohio, DC in the house. Love it. So take a look and see your colleagues who are joining us today. So we're going to move on while you guys are typing that in to our poll questions. So we recognize that the current prevalence and status of COVID-19 greatly impacts where you may be in this work, and the lack of centralized approach on how to handle these crises means that there's a lot of variation on how communities are being impacted. So first, we'd like to hear, how would you describe the current state of COVID-19 cases in your community? So we have, are they increasing significantly, increasing, decreasing, and significantly decreasing? So just give us a sense, and if none of them get exactly where you are, give us the closest approximation. Okay, and then Josh, do we have a good number of responses to just share with folks to see where everyone's at? Maybe another second. Okay, so not surprisingly, a little bit in each category. Great. And then for the second question, we're curious to see how the answer to this first question may impact the second one. And that's really, how involved is workforce development in your organization's current response to COVID-19? So again, we recognize that your engagement may have changed throughout the last couple of months, and we're really interested in hearing what is the current level of engagement. So we have highly involved, a little bit involved, and maybe you're not at the table at all just yet. Okay, how are we doing on responses? Okay, similar, right? We got folks in a little bit all over the board. So great, thank you so much for sharing that. Really appreciate it. So on today's call, next slide. Can we go to the next slide? Thank you. So on today's call, we're going to hear from two CareerSTAT leaders. Gerard Camacho is the AVP of Workforce Development at Atrium Health in Charlotte, North Carolina. Gerard was a participant in our first Healthcare Workforce Development Academy and now provides technical assistance in the second cohort and is Vice Chair of the CareerSTAT Executive Committee. And then we will also hear from Joanne Pekaski, who is the Senior Director of Workforce Development and Community Relations at Beth Israel Deaconess Medical Center in Boston. Joanne, you may be familiar with because she is a founding member of CareerSTAT and a long-serving member of the Executive Committee in various roles, and recently transitioned to the National Fund Board in the spring. So for the context of this conversation, we all have experienced as budgets tighten, it's not uncommon for workforce development investments to short-sightedly, in my judgment, be deemed as non-essential, right? Staffing shortages were a reality in many places prior to COVID, and now with many pipeline programs being paused, a high unemployment rate, and many health systems facing substantial decrease of elective surgery revenue, the ability to effectively make the case for workforce development has not been more critical, right? So Gerard and Joanne are going to share how they've either doubled down or adjusted their strategies to make the case not only to continue workforce development, but how they can really strengthen this strategy within each of their organizations. So without further ado, I am going to turn it over to Gerard to get us started. Next slide.
All right. Hello and good afternoon, everyone. I'm really excited to be here, and it's really excited to see multiple names. Now it's not faces, right? So the new way of communicating and connecting with others, has changed. But nevertheless, we're still connected and we're still here for one another, which is a great thing. For me, I was there during the kickoff of this year's academy, and I'm here again to just go ahead and share some of the things that we've been doing in regards to workforce development and how things have changed and the things that we have done to make sure that we include workforce development as a community initiative. I know that there's some organizations here like Advocate Aurora Health. I don't know if there's anyone else that is joining us from Cleveland Clinic or anything else, but there's some institutions that currently do this anchor strategy. We're trying to emulate that. And in that, we've done a really profound and deep discussion of what workforce development is. And with that, I'll just go ahead and share where our discussion has gone in the midst of COVID. So again, Atrium Health is an organization. We're a healthcare system that is in Charlotte, North Carolina. We're currently in 3 different states. So we're in Charlotte and North Carolina, of course. We're in South Carolina and we're in Georgia. We have about 42 hospital systems, bunch of clinics, and about 80,000 employees. We're in conversation with Wake Forest Baptist, and this is no secret, to make sure that we to do a merger. So with that, we would go ahead and increase to about 100,000 employees, and we keep growing as many of you are through this process. So it's funny how that hasn't stopped in the midst of COVID, right? The mergers and acquisitions and the continuation to expand is still taking place in the midst of all of this madness. But so with that, my background, I'm in workforce development, and previously I was in Texas, also doing similar work on their Frontline health and hospital system. Before that is banking, and a little bit before that was even municipal government. And through my career, I've been always exposed and involved in workforce development initiatives and activities one way or the other. But now I have the privilege of leading this for the entire system at Atrium Health. And what's funny about it is that you guys have seen this. I mean, all of us are in different areas and in different really areas of the organization across the system, right? Some of us come from learning and development backgrounds, and that's what workforce development is. Some of us come from nursing education, and that's where the workforce development strategy is to engage individuals in the community and to grow pipelines. So with us, some of the things that we have done in the midst of COVID is that we started seeing that those social determinants of health continue to take effect across the community. And whenever we were trying to realize or to figure out what our anchor strategy would look like, we know and understand that there's all those social determinants that are guided by community health, community relations, government relations, impact, procurement services. And one important one that is sort of a miss in the anchor strategy is precisely workforce development initiatives. And it's something that we have very well documented, evidence-based in National Workforce Solutions and CareerSTAT. So one of the things for us logically to do was to merge all of that anchor strategy, to merge the community relations, the community health activities, the government relations with what is workforce development, because that is in the essence as we're trying to further the benefit that we provide to the community, that community impact, then we need to make sure that we're doing not only sustainability from healthcare education, access to healthcare, whether we're doing community investment in housing, or whether we're advancing community relations with government entities to further education, right? And whether our diversity and inclusion strategies from the inside are really reflecting our population kind of distribution. And so we do the same in leadership opportunities and development. So all of that is kind of moot whenever we don't have a workforce development strategy attached to it. And as we were going through this, and right before COVID, we were having these discussions, but now we're seeing that through this process, those populations that are usually left behind, that are people of color, people that look like me and some of you out there, are continue to have these challenges in terms of access to healthcare opportunities, access to permanent employment and skill set development and growth, right? And we're seeing that displacement of unemployment is greatly impact our colored communities and also our diverse communities across the United States. So one of the things that we needed to make sure is that we double down on that strategy to say, if we're going to drive community impact, we need to make sure that workforce development is at the front of all of these activities related to the community relations and the community impact and how is it that we drive systemic change, not only within our organization, but also through our social impact plan, and how is it that we drive that measurement of how do we develop individuals, how do we develop businesses, how do we develop the community, and how do we create that anchor strategy? What is our value proposition as a system? So with that, we realized that workforce development was going to be attached to all this work that was taking place, but it was really enhanced through COVID because of community health resources and how is it that we're engaging the community, and how is it that we need to make sure that we have anchor strategies that matches the value of the organization with community building and relationship building. How is it that we provide workforce initiatives between sector and government, not only for us. At this point, there was a lot of organizations, like many of you out there, that were using resources and revenue and in already challenging times. So we continue to see that in our region, in our community, with other hospital systems, with other sectors that were pushing away their workforce development initiatives in either their summer internship development and activities. How do we engage those members of the community that were greatly impacted? And what we try to do is that we try to become an advocate and a voice for why this is important in the midst of COVID and why this is important to continue to drive value to our community impact strategy, and why it's now more important than ever to do so. So with that, we went ahead and created the talent pipeline strategy for the system and developed those programs that were based on the needs both of the organization to do the ability to go and forecast 1 year, 2 year, 3 year needs of the system, with then matching what are going to be the needs of the community and how is it that we can bring about those talent pipelines into fruition to address the system needs. So next slide. And basically where we landed in the middle of COVID was that we were going to do the community external affairs was going to go a revamp, and really workforce development was going to be driving the community impact initiative for the system. And basically we gather information from medical education, from nursing, from workforce planning, which is our data analytics team, learning and development, talent acquisition, and our allied health functions to inform what are going to be the system needs. What are the system priorities for development? How is it that, I don't know if you guys saw this or in your hospital systems, but there was very deep conversations about, well, do we bring even students into the hospital setting to complete their clinical training and their education? We have very big discussions with the 3 different sectors across town to say, yeah, we do need to continue to drive that, because that is in the midst of COVID. We need to make sure that we're providing not only opportunities for those individuals that are trying to pursue healthcare careers, but we need to make sure that we're doing this so that we can be ready in case there's a surge, and then we have access to resources. How do we rethink the experience in terms of how they can be additional resources that can come about and help us develop and drive all of these, meeting all these needs for the community. And then that goes and really drives the workforce development strategy, which is a system-wide workforce initiative that addresses the system talent needs at national efforts. And with our Charlotte Executive Leadership Committee, one of the things that we're doing is that as we're gathering more data in terms of what are our regional markets looking like, what are the regional needs, the workforce development strategy is really looking at how is it that we can create talent pipelines in Macon, Georgia, with a complete, oh, did I lose you guys? No. How is it that we can drive change in our urban region in Charlotte, North Carolina, but we can continue to have that value proposition in Macon, Georgia, which is a suburban region and a rural area, right? Very different communities, very different strategies, but we still need to make sure that we have an umbrella in the scope that is defined by, we need to make sure that we have workforce development initiatives to meet talent needs of the system. Because even though they may look different in an urban setting versus in a rural area, we need to make sure that at least we have metrics, data, reporting that are guiding the initiatives and that are informing our strategy of how is it that we go ahead and implement programs. I mean, do we need GED and ESL basic activities? Do we need to increase CNA training, or do we want to develop patient care technician certification training? Do we need apprenticeships? Do we need to go ahead and increase the relationships in between government and functions, and how is it that we bring about summer internships into the system? Do we need to engage that youth? What are our talent needs? Is it IT? Is it clinical? So all of that, it's a universal strategy by which we're guiding all this workforce development really work, and the ability to bring it forward to the executive team to say, we need to continue this in the midst of this pandemic, and we need to make sure that we are actually enhancing this, because it goes to drive our value proposition and our relationships to the community. How is it that we engage and interact with local governments, with local education systems, with how is it that we're guiding the different talent pipeline needs to meet the organizational challenges for all our market sectors, and everything is related to that workforce development initiative. So we create that value proposition for the system to say, we are meeting the demands of the system, whether it's going to be immediate needs through, certifications and rapid training, or is it going to be long-term needs to make sure that we're guiding make sure that the community has the resources and the skill sets, the competency training, so that they can get that talent that we need in the next 3 to 5 years as forecasted. At the same time, we're doing measurements of recruitment and of engagement, of retention. So all of that is taking place with a workforce development view. But mainly through that, we've been able to then say, now this is what we want in return. We want to make sure that we're driving a diverse workforce population. We want to make sure that we're providing and changing tuition reimbursement policy, for example, to go ahead and address those needs. And how is it that after a quick review of our current practices, we're seeing that, hey, really the beneficiaries of the tuition reimbursement policy that we have is individuals that are already in high nursing roles and that are grossing about $70,000 to $90,000 a year. There's not a lot of diversity there. So we're seeing that 70% of our tuition reimbursement funding goes there, whereas minority groups and low-income groups are receiving just are participating at a rate of just 18%, right? So we know that there's an issue of equity in how is it that we distribute those benefits and those resources. So through this conversation of guiding this strategy for the system in terms of meeting the talent needs for the system, for every single sector, for market, for driving data, for driving return on investment, we're able to now, as this anchor strategy, drive that community impact to say, we need to make sure that we have proper diversity and inclusion outcomes here. We need to make sure that we have equal distribution of those opportunities to make sure that individuals in the low-ranking groups in terms of income are able to participate, if not equally, to a greater extent than those that do have the resources to continue to advance. So via that strategy, we've been able to now put conditioning into how is it that we develop strategies for the system. It's not only about creating that talent pipeline anymore, but it's about how is it that we engage those areas of the community where we know there's lagging in terms of opportunities and that we can bring about that movement, that change. How is it that we can create now diverse programs for leadership development that are not just about having those individuals participate in a certificate, they get applause, and then after that, nothing happens. We're actually, how are we measuring, or how are we going to measure that continued growth in the promotion of those individuals and people of color to be equal to the distribution that we see within our community and our patient population. So through that, the workforce development value proposition now addresses system needs that formalize development opportunities to address economic mobility within our organization and the communities. But more importantly, we're working with key stakeholders to mobilize and address those talent needs and to increase those talent pipelines while we're addressing those social issues. And with that, I mean, that's the work that we've been doing under COVID. Of course, we have continued our summer internships and continue to work on all those talent pipelines, internal, GED classes and the Rise to Success programs where we're getting, or education networks where individuals are participating and providing wraparound services. We're continuing with that, but through this lens, through this process, through these challenges that we've seen in the past 3 months, we've been able to create so much more in terms of impact, because as we're trying to bring forward the workforce development initiative, the value of what it does to not only address the system needs and drive quantifiable, measurable impact and return on investment to the system, but also to drive and to be an advocate for those social mobility, income mobility initiatives that we know are so needed in our communities.
Great. Thank you so much, Gerard. That was a great overview of how, so many important things are interconnected, and when you're able to really make that explicit, it can be really helpful for bolstering your case. So now we're going to turn it over to Joanne.
Good afternoon, everyone. I see a lot of friends on the call, and good to see you. I miss your faces. We can go to the next slide. So I work at Beth Israel Deaconess Medical Center. We have 11,000 employees with a very wide range of skills, from the people who mop the floors to people with multiple PhDs doing research. We're one of 14 teaching hospitals in the Boston area, and we became a part of a new system, Beth Israel Lahey Health, in March 2019. We have 11 hospitals and 35,000 employees as part of this new system, and we have yet to fully integrate. I am part of HR, but we've yet to fully integrate our HR function. Next slide. So I like to think of the work we do at Beth Israel Deaconess Medical Center in 3 buckets. So one is we've figured out a way to train up our employees into jobs we're having trouble filling through pipeline programs where we competitively select employees who'd be a good match, and then we sponsor their training into a new role where they're making more money and have more skills. We also focus a lot on the employee skill and career development. So we focus a lot on our 11,000 employees and how can we support them in moving up within the organization. We have a career advisor that anybody can go to. We have free college courses on site, ESOL, career advising, many workshops on how do you put together a resume, how do you do a great interview, things like that. And then our last bucket is how do we make sure the people who live near the hospital are connecting into us. So in that bucket includes working with community-based organizations that are trying to train people into healthcare, taking referrals from a lot of organizations, hosting internships, and also hosting paid summer jobs for about 40 young people a year from the community. Next slide. So I started a workforce development program there about 16 years ago, and we think about how are we building the talent that we need and how are we a good employer. About 2 years ago, I took over community relations as well. And in that role, I think about how are we being a good community member. I think most of you who do workforce development won't be surprised to know that there's a lot of overlap between community relations and workforce development. And if you're hiring people from the community and collaborating with a lot of folks in the community, trying to connect people to good jobs, you're doing community relations and workforce development. And I would say both of those have a good overlap also with diversity, equity, and inclusion. And this is how I think of it. So I think we are, we're a piece of diversity, equity, and inclusion. We're not the whole piece, but again, a lot of overlap. So let's go to the next slide. So COVID hit, and it hit Boston pretty fast, very quickly in March. And we moved from our regular structure to an emergency structure where we're not business as usual. Anything not related to COVID was a distant second to getting ready to treat a lot of COVID patients. We had about 70 ICU beds, and we built up capacity to have 200 ICU beds. And at the worst of the surge, we used about 135 ICU beds. So I just want to talk about some of the work we did and what changed in these buckets. So we had a patient care technician program where we selected people from the community and did a 3-week paid training. Patient care technicians, highly helpful in a COVID situation because they're helping in the inpatient space. But a decision was made by our nursing department that we were in the process of selecting people to move into this program, and our nursing department said, whoa, we don't have the nurses to train people to do this, and we don't want to hire people into this crazy new environment at this time. Like, we're going to have to put this program on hold. So we did. We have an associate degree nurse program where we're trying to encourage, we're trying to get more diverse nurses. We have a challenge in hiring diverse nurses. So we have a pilot program that we're gearing up to do our 2nd year of, where we selected people with an associate degree in nursing, and we're going to sponsor them. They do a longer orientation, and we'd sponsor them to get their bachelor's degree in nursing. That program we pressed pause on because we were supposed to do all the recruiting over the summer, and we felt that, again, nurses' frame of mind was completely elsewhere, and they couldn't focus on it, and they wouldn't be ready to bring people in September and have them start. And then another program was our central processing technician program, where we select people and have them go through a year-long program that starts in September to be central processing technicians. That program, we didn't need to start looking for people till the summer, but we needed to, if people didn't start in September, we were going to lose a year of cohort of people. So we were able to convince people that we would start that program. And that was one of the first post-COVID emails that went out, like a normal email about business as usual, like, hey, we're looking for central processing technicians. So we're happy that that's on track to start in September. But our selection process looks different, and our info sessions look different. Nothing's in person anymore. So we've had to adapt how we do our normal line of business to move forward. So on pipeline programs, we had to kind of change a little bit what we did. For our associate degree nurse program, we knew we couldn't keep our same timeline, but one of the things we did was we said, okay, we think we could do this for a January start instead of a September start. And so we were very deliberate in making the case for a January start. So this just never the problem with pausing is things could be on infinite pause, right? And we felt it was important to keep this program going. So we kind of made the case in a document for how we could start in January and what that would look like and how we'd be ready to do it. And then we shared that with our nurse leadership, who was very overwhelmed still with COVID, but they were able to read that and say, okay, yeah, let's make that plan. We can do that then. In that second bucket, we had to take all our classes virtually. So our college classes went to a virtual class, and our ESOL classes with our partner JBS, they all went online as well. And last, in the community hiring bucket, we have a summer jobs program where we bring about 40 kids on site for paid summer jobs. And we made the decision, I think it was in April, that, you know what, we couldn't say that we would be allowing young people back in the hospital this summer. So we worked with Children's Hospital and the Brigham, Dana-Farber, and we all made a decision that we decided to scale back the program, but we held an online program. So we still are offering a paid program. This summer it's for 20 kids, and we're providing a lot of content for young people to be the equivalent of working in the hospital and learning about careers in healthcare. Next slide. So PowerPoint does not have a graphic that is sufficiently complex to talk about how these three crises interact with each other and the timing of all of these. But, we had the COVID crisis, and then we also had a financial crisis where, my hospital's always been a lean hospital, and then COVID sort of made that situation work. And then we also, George Floyd was murdered, and we had a diversity, equity, and inclusion crisis. So I just want to talk about some of those things. We had the COVID crisis. We didn't play a big role, and we had to kind of pick our battles. We had a financial crisis where we had some paid furlough, we had some unpaid furlough, and in that unpaid furlough time, if you weren't directly related to helping treat patients with COVID, it was expected that your team would cut back and take some unpaid furlough. So a lot of people on my team took a 50%, took about 3 weeks of unpaid furlough. I took 2 weeks of unpaid furlough. And it was hard to not be in the mix and not feel critical to the organization, but we felt critical for so long. But we are, a longer term, we're really focused on longer term strategies, and this was a short-term crisis. So, not our best time. And then George Floyd was murdered, and suddenly there was a lot of interest in diversity, equity, and inclusion. And there I felt like we had a lot to say, and we really could play a large role. So, we've been doing workforce development for 16 years. We have had 2 years of an intentional diversity, equity, and inclusion program that's built some things, but it's been a little slow out of the gate. So I learned there'd be a system task force thinking across the system about what can we do around diversity, equity, and inclusion. So I talked to my boss, who's the head of HR, and said, I'd really like to be part of it. And she's like, oh, I don't know. Let me see. And then we got an email from the head of HR for the system talking about diversity, equity, and inclusion. And I emailed back and said, let me just remind you what we do. And I think we have an important role to play in diversity, equity, and inclusion. I didn't hear back. And then our CEO sent the email, probably a lot of your CEOs sent, about this is a really important issue to us. And he said, we're going to create a task force. And I wrote back and I said, I'd like to be part of that task force. And just want to remind you of the work we've been doing here. And I think a lot of these issues are very important to our staff. And then the co-chair of the task force was somebody I'd worked for years on a program to support diverse managers. And so when I heard he was named to the task force, I wrote him a note saying, hey, I'd really like to be part of this task force. So we had, everybody was kind of like, oh, that's nice, we'll see, blah, blah. We had a leadership retreat, and one of the subgroups was diversity, equity, and inclusion. And this was, again, when suddenly this issue became big. And so I went to that retreat, and I brought my big, bold ideas of how we should move forward. Like, this is the time to put it out there. And we talked as a group, and then I presented out, here's what we're thinking around diversity, equity, and inclusion. And then I learned that I had been asked to join the task force. So we've had our second meeting. It's going to be over 10 weeks. But I do think as workforce development, we need to be in the mix. We understand frontline workers and what supports they need. We don't solve everything, around diversity, equity, and inclusion, but I think we have a lot to share. So some of the things if we go to the next slide. Just, in some of my correspondence, I listed all the workforce development programs that support diversity, equity, and inclusion. And maybe, we all do the work we do, but if you really think about it, so much of that work really supports diversity, equity, and inclusion. And positioning it that way and getting a seat at the table, I think, is really important, as it seems to be that people are open to kind of bigger, bolder ideas and making some changes. So this is the time to advocate for workforce development and bring your big, bold ideas. So that's my story.
That's great. Okay, so thank you so much to Joanne and Gerard for their presentations. Can we go to the next slide, because it's question time. So we do have a few coming in from the chat box, but I again encourage you to do more. And one question from Megan to Joanne is, how did you frame that conversation with nurse leadership to get them to re-engage?
So I was very cautious of the timing and the energy, right? So I wanted to get them at the right time where they would have the attention to think about it again. So that was when we were post-surge and our cases were starting to go down and people started talking about the future again. I was like, okay, this is a time where we might be ready to engage the nursing team again. And also I wanted to present it so that they didn't have a lot of decisions to make, because a lot of them were pretty fried from the COVID crisis. And so I wanted to make it really simple for them to say yes. And for them to just see a plan that they knew they could execute.
Great. So, Joanne, you have mentioned, this idea of opportunity to be bold, right? Like that this is, in many organizations, diversity, equity, and inclusion has been something that's been on the table for a while, but it often is, let's convene a task force, let's do a training, and these things that are a little bit more esoteric, right? And not really action oriented. So for both of you, I'm interested in hearing, what type of opportunities do you see for building a more equitable workforce, and with that kind of being bold and specific kind of space in mind?
I'm happy to start, and Gerard, if you want to jump in after. I think one of the challenges is when you get into diversity work, there's a lot of let's think and let's educate people, which is good. But if you're a person in the organization, you're like, is anything happening? Didn't we have a task force a year ago? And so one of the nice things about workforce development is a lot of people can see it, right? You announce your program, it becomes clear what it's about and what it's trying to do. And so, I think my team has always had an ability, I think a lot of our teams have the ability to kind of get a program to the blocks and to the finish line. And so this is a good time for programs that you can kind of get out there and actually make happen, because I think it helps people feel like change is happening. And I think that's really important. So some of my big, bold ideas that I put out there were recognizing frontline workers who have been huge heroes in this crisis. And a lot of times our doctors and our nurses get so much love, but our frontline workers really stepped up and came to work every day, put themselves at risk, put their family at risk. How might we recognize frontline workers differently than how we have? And how can we think about that a little bit differently? We've kind of struggled with diversity in our leadership. And, I think it's time maybe to, could we put together a mentorship program? I feel like at the manager level is where we lose a lot of folks. And can we really focus our energy there in supporting diverse managers so they stay and they grow within the organization? So those are some of the ideas I've been putting out there.
Gerard, did you have anything to add?
I absolutely agree. I think that there's a difference in between having workforce development, check boxes of diversity and inclusion to make sure that you have that diversity class, do you have diversity for leadership, or we're going to hold these sessions, or we're going to have the resource groups. But right now for us, it's been translated much like that in the same way to say, well, workforce development is going to be part of the goals, the anchor strategy for the system goals. And what we're going to do is that we're going to start holding people accountable through this process of whenever you do workforce development through your, whether it's going to be end of year evaluations or we're going to the system of leadership and capacity, and we're going to be doing that succession planning. There's going to be specific activities for making sure that we're we're counting the numbers of individuals participating in those programs. What is the result of the promotion rates for diversity and inclusion purposes? Holding leadership accountable for those, and making sure that whenever we're driving our talent pipeline strategies to make sure that we're quantifying that value from whether it's going to be through diversity and inclusion in terms of procurement spending, right? How $1 million goal of how do we grade, how we get minority and women-owned vendors to participate. Same thing with the summer internship programs. We're starting to put just holding people on goals, and that includes, those specific numbers of how many are in the city, how is it that the promotion rate affects the promotability of the individuals, what does that look like for diverse groups versus non-diverse groups, all of that, and then just having goals to address those issues.
Thank you. So then we have another question here around whether or not folks are still providing in-person services. So have you shifted in some or partially of workforce development training and case management to virtual? And how are you supporting beneficiaries in a virtual environment? And I know, Gerard, you have gone quite a few, so I'm going to push you. But I do want to mention that you were breaking up a little bit, so I'm not sure if you have a higher, where, can you hear me now on your cell phone? If there's a better way to just get a little bit more to not break up to answer that question around virtual learning.
I can hear you. I don't know if I'm breaking up. So I'm happy to dial in. It's an issue.
Yeah, well, I mean, let's see how we can get here, and let's see if it continues to work a little bit, and then if not, maybe you can dial in when Joanne takes the question.
Absolutely. Okay. So in terms of virtual, we went. So we opened the Career Development Center in November, and we were going to do everything in face-to-face learning, right? All the program activities they're putting under the umbrella of Career Development. Sudden, we're February and March, the 13th hits, and we're like, oh, we'll go back to.
Okay, Gerard, I'm going to pause you. It is, in fact, that we can't really hear you and breaking up. So I'm going to pause you there to shift it to Joanne, and if you could call in, that would be great. No, it's okay. I just want you got good stuff to share, and I want to make sure people can actually understand it and hear it. So pausing you to shift to Joanne.
I'm happy to take that question. We'll see you in a minute, Gerard. Or hear you in a minute. So I prefer person-to-person. I think our employees prefer in-person. They learn better that way. We've kind of held off on doing virtual, and we've been able to hold off on doing virtual. But now it's just too hard, so we switched to virtual when it wasn't a choice, but I don't see us going back to in-person in the fall. There's still just so much uncertainty as to what's happening. So we're going to stick with virtual where we can. As a central processing tech program is an example. So our community college runs that. It's going to be virtual classes, but then they're going to have them come in on the weekends and do a lab socially distanced for the part that really needs to be hands-on. So there's, there might be some pieces that are going to be hands-on, but we're, for everything that can be virtual, we're going to keep it virtual for as long as we can, and then do the hands-on pieces how we can. But I think, being virtual also offers us a good opportunity to think about, we have some satellite community health centers that are affiliated with us and things like that. And before, in the in-person model, they have to get in their car and drive and come to our class. But now, since everybody's virtual, it's easier for them to connect and be just a regular part of the class. So I do think there's an opportunity to sort of open up our services to a wider group of people as well if we keep it virtual.
Thank you. Gerard, have you managed to come back in? Okay, so I'm going to move on to the next question while he still works that out. And so Missy from New Orleans is curious, does your workforce development tie into talent management within your org? What does that look like?
So we have sort of what used to be called staffing, now is called talent acquisition. That's a lot about filling, they're in charge of filling the roles in the hospital. And so workforce development came after this talent group, and we're really focused on, for roles that don't work, where they're having trouble filling or filling with the right people, that's where we step in. And so we'll run a program, but we work very much with them because I can't hire a person without working with talent management. So when we're going to start a program to help a hard to fill area, we'll bring talent management in, they plan it with us, we run the program, and then we kind of hand it off for the sort of actual hiring and onboarding. And they're well aware that, you know, I've got 4 candidates graduating in May, you can pop them into the job. So it's a healthy relationship, and it's good for them because instead of tearing their hair out wondering how they're going to get people, they know they've got 3 people graduating in April that they can pop into the job. So we work very closely together. An interesting example is, you know, so we have the central processing tech program, and we have a lot of people who are interested in it. We also have this new job that we need, which is people to sterilize the N95 masks that a lot of us use. So there's a new job that's being created for N9. I don't even know, we haven't even named it yet, but it's going to be sterilizing N95 masks. And it's going to have a lot of similarities to the central processing tech job, but not require that education. So we're hoping that for people who aren't selected for our program, we can point them to this other new job that's starting that they might be interested in. And it could be a great source, like a great way to source people into this new role.
Thank you. And I'm multitasking with tech. Gerard is on the line, but I don't think we can hear him, but I'm going to pause. Gerard, can we hear you? We cannot hear you. Okay. So I have tasked my tech colleague to try and help figure that out, but we do have some great questions here. So I still want to move along, and then hopefully we can get him back online to share some of that stuff around the virtual learning, because they're doing good stuff. So let me get back up here. What thoughts do you have for engaging organizations to work with nonprofits to provide internships to prepared workers?
So you say that again?
Yes. What thoughts do you have for engaging organizations to work with nonprofits to provide internships to our prepared workers? And that's Yvonne. And I don't know, Yvonne, if you have a little bit more context for that, if that's not clear, whether you're looking for using CBOs or other partners to help build the skills?
I'm happy to talk about that. So I'm going to answer this question as I think it is being asked, but if not, let me know. So I came from OneStop Career Center. So I was in the business of trying to connect people to jobs and working with people who've gone through training, and now we're trying to connect into jobs. When I was at a OneStop Career Center, no hospitals would return my phone calls. So when I moved into the hospital, I was like, we're going to return everybody's phone calls. So any nonprofit that's training people, we will return their email, we'll sit down and talk with them about what our process is, and we'll figure out if we can work with them. So that could mean host, you know, some people like the YMCA Training program, they have a didactic program where they teach people medical office skills, and then they're going to do an unpaid internship on site with us and learn what it's like to really work in a medical setting. And then a lot of those folks just get hired. So we love working with nonprofits. We also work with some other nonprofits that are just referring folks over and making their case. And we'll make sure, you know, in an electronic system, sometimes people can get lost or you don't know, you know, it feels like your resume goes into a black hole. So we try to have a dialogue with the referring nonprofits around what's happening with that candidate. And are they a good candidate? Are they not a great candidate? Are they doing well in the interview? Where are they in the process?
And so she followed up to say that they run a full service workforce development program for a nonprofit, but have difficulty connecting with larger organizations to take a chance on their clients and entry level. So it sounds like your experience with OneStop might be some of her experience now.
And I think, my advice to you is, are there workforce development programs? Are there people? It's hard to figure out, the nice thing is I come from that world, so I understand that world and how we can work together. But if you don't have somebody who's thinking about the workforce or hiring from the community, it can be hard to break in if there's not an appropriate person in the infrastructure to work with you.
And then we have some interest here on specific DEI goals. So there are some folks that have, they have some regarding education leaders about implicit bias and inclusive leadership, but folks are interested if anybody has specific numbers in terms of increasing percentages in specific professions or department with dedicated resources to meet those targets. And I will allow Joanne, but if anybody has this on the line, we'd love to hear it in the chat as well.
So I think I'm answering the question again, but let me know if I'm not. So one of the things we did as an organization as part of our DEI work is I was like, can we just talk about who we are, who's here? And we actually looked at what do we look like as a workforce? We're 1/4 male and 3/4 female. Here's the percentage of white people who work here and here's what our city looks like. Here's what our community looks like. And then we kind of broke it out by job group, not like job, but like rough job groups. And we found that, not surprising to a lot of us, that we have diversity in a lot of jobs, but there are some areas that have resisted being diverse, and one of them is management, and another one for us is nursing. And so how do you think differently about how you're hiring people into those roles if the diversity distribution in those roles is so different from your community and so different from the rest of the hospital and what it looks like? So it's not really a goal, but I think it's a kind of a North Star, right? Like when you see some job groups are just really far off from what the rest of the organization looks like, you need to think about what's going on there and try to see if you could have a more normal distribution.
Okay.
Can you guys hear me now?
There it is! Yay!
It's back.
Excellent. Okay. Finally. Great. So where were we?
You were talking about they were looking for some specific examples around how you, changes you've made to make stuff go remote, your internships and your pipeline programs going virtual.
Everything virtual, and then I heard from diversity and inclusion. I'll try to be quick on both. So we did revamp the entire portfolio of activities for summer training, whether it was going to be our talent pipeline programs, partnership with our community colleges to continue CNA training to go completely virtual, or the summer internships themselves to be virtual. So we trained the leaders to go ahead into virtual mode. We changed the curriculum. We did competency-based training for students before they came to us. Then that means for all Mayor's Youth Internship participants, we partnered with Red Ventures to do this. And we did competency training before they started their summer internship. And then our summer internship programs have been completely virtual. So how to do that, how to get access, how to do project-based learning at home, how to do reporting, all that, WebEx meetings, things like that. So everything has changed and modified. In a lot of our programs too, GED, ESL, a lot of our participant programs has been completely revamped in terms of, we went through a process of transformation in between March and the beginning of May to switch everything that we had into now online learning. So that was a challenge, but it was a great experience. And then we didn't do it alone. It was a lot of partnership with a lot of the community colleges, with different organizations, things like that. And then in terms of diversity and inclusion goals, one of the things that we have is that we have embedded that into the succession planning, which is a really important one. And this is for leadership, everything from director and above. So that means that we assess and we review managers from potentials to AVPs and VPs for senior VP positions. Of course, we do something completely different for EVP level. But Now, through diversity and inclusion goals, through these conversations, because of everything that has happened in the past few months, we have quantifiable data in there to say, well, there's going to be a minimum requirement of these number of minority groups or individuals to participate in succession planning. And then we're going to go ahead and provide specific training and programming for them, which should result in the next 2 years in promotion, and we're going to rate that, and there's going to be some numbers and deliverables, and there's going to be some actuals there.
Great, thank you. So we have a few questions that we weren't able to get to, but we will work to get those answers and continue the sharing, right? This is our first webinar of the series, and I think some of these issues and questions are going to come up time again. I was hoping to get a little reflection for folks, and so if there was anything here that really resonated with you or sparked a new idea, if you could just chat function us, just a few little ideas. I know we are almost at time, but in this last 30 seconds, I'd love to hear, you know, what hit home for you, or what nuggets from this conversation are you really taking? So I really appreciate it. And we got some accolades for our presenters. So of course, thank you all for the time and energy of being present and focused, and for our presenters today, despite some of our technical issues. And then if we go to our last slide, it's just a little preview for the next one. So our next one is going to be around strategies to integrate REI in the recovery and beyond. So what does that look like? And we're going to be hearing from some of our CareerSTAT folks and leaders in the Chicago area. So stay tuned. More information on that is going to be coming out in a couple of weeks, along with the registration link for that. So stay tuned. But after this, we will also be sharing a recording of this webinar, the slides, and any additional follow-up that comes out of these questions that we weren't able to get to today. So thank you all so very much for your time and attention, and staying on 1 minute extra, and I hope you have a wonderful afternoon.
Bye, everyone.